Hello, today we're going to talk about fibrous dysplasia. Fibrous dysplasia can occur anywhere where there's bone, but primarily it occurs on the ribs, the craniofacial bones, especially the maxilla. It can occur on the pelvis as well as long bones. Fibrous dysplasia can be monostotic, just one lesion, or polystotic, or multiple lesions. On histology, your key things to look for fibrous dysplasia are these Chinese letter-like bones, these irregular, thin, curvy trabecular bone. The second thing you want to look for is surrounding those irregular bony trabeculae, bland fibrous cells and stroma. Let's zoom in closer. You see that these fibrous cells are bland. They're not enlarged, there's no pleomorphism, there's no mitotic figures. And in the interface between the trabeculae and the fibrous stroma, there's not a lot of osteoblastic rimming. That's something you want to look out for, because if that happens, then that's suggestive of osteofibrous dysplasia. And because we don't have those osteoblasts, this is just fibrous dysplasia. Another important differential to keep in mind is parosteal osteosarcoma and low-grade central osteosarcoma. Both look very bland compared to your traditional osteosarcoma that has malignant osteoid and atypical cells. From my experience, location helps. So parosteal is behind the back of the knee, classically. And low-grade central occurs often on the long bones, intramedullary. The femur and tibia are common places. And you can also get an MDM2 amplification if you are not sure. The latter two, the osteosarcomas, the low-grade central and the parosteal, should amplify. Fibrous dysplasia is not driven by a MDM2. It is driven by GNAS mutation. And that gets me to talk about syndromes related to fibrous dysplasia. When you see fibrous dysplasia, think of two syndromes. One is McCune-Albright. That's where you have the cafe au lait spots, or the coast of Maine spots on your skin. You have polyendocrine activity, such as precocious puberty in especially females, and you get fibrous dysplasia. The next thing you want to think about is Mazabrats. You get fibrous dysplasia as well as soft tissue myxomas. And that is fibrous dysplasia for today. I'll see y'all next time. Bye.